I want to start with something uncomfortable. Right now across Nova Scotia, some of the most important people in our province are exhausted. Not tired, exhausted. The people caring for our parents, the people caring for our grandparents, the people showing up at 3 a.m. when somebody is scared, confused, in pain, or dying. And the people trying to lead these organizations, you're exhausted too. Because whether you're an executive director, a CEO, a CFO, an HR leader, an operator, you're carrying pressure from every direction at once. Government pressure, union pressure, labor shortages, inflation, benefit cost escalation, recruitment challenges, retention challenges, mental health claims, burnout, absenteeism, violence in the workplace, family expectations, and resident expectations. At the same time, you're somehow still expected to maintain quality care, financial stability, and workforce stability. That is not a normal operating environment. And I think everyone in this room knows something important. This is no longer just a staffing problem. This is a trust problem. Employees are asking, does anyone actually understand what we're carrying? And leadership teams are asking, how do we continue to hold this together without breaking financially? That tension right there is where the future of continuing care in Nova Scotia will be decided. Now here's where most advisors get this wrong. Most firms walk into organizations like yours talking about products. They lead with rates, renewals, carriers, spreadsheets, benchmarking, marketing decks, and look, all of that matters, but none of it solves the real issue. Because the organizations that are going to win over the next 5 to 10 years are not the organizations that have the cheapest benefits plan. They're the organizations that rebuild workforce trust faster than anyone else. The game is now. And benefits are no longer an HR function sitting quietly in the background. Benefits have to be one of the loudest signals of your organization, to recruits, to employees, to unions, to families, to leadership teams. Your benefits strategy now communicates, do we value our people or not? At Newground Financial and the CSPT, we believe the continuing care sector deserves better than transactional advising. This sector needs strategic partners. The people who understand that you cannot separate workforce stability, organizational culture, financial stability, and employee well-being. They're all connected. And what we're seeing across Canada is that organizations still approaching benefits like a yearly purchase are falling behind. The leading organizations are doing something different. They're using benefits and total rewards strategically, not reactively. They're asking, how do we reduce burnout? How do we keep people longer? How do we improve attendance? How do we support mental health before disability claims happen? How do we help managers lead exhausted teams? How do we become an employer people talk positively about? Because here's the reality. In this labor market, people do not solely choose an organization because of compensation. They stay because they feel supported. They stay where leadership communicates clearly. They stay where benefits actually work. They stay where someone has thought through the employee experience. And most importantly, they stay where they feel human. I want to tell you something that I've learned when working with organizations across Atlantic Canada. The highest performing organizations are usually not the ones spending the most. They're the ones that are aligning their people strategy with their operational reality. Big difference. Because throwing money at dysfunction is not a strategy. And cutting costs blindly during workforce instability is usually even worse. The real opportunity sits in the middle. Thoughtful design, intentional communication, data, leadership alignment, employee trust. That's where transformation actually happens. And let me say something directly to the executives in the room. You do not need another vendor. You need someone who's willing to tell you the truth, even when it's uncomfortable. If your plan design is hurting retention, we'll tell you. If communication strategy is creating confusion, we'll tell you. If your managers are unintentionally damaging trust, we'll tell you. If your organization is overpaying in the wrong areas while underinvesting in the things employees actually value, we'll tell you. Because leadership teams do not need more noise right now. They need clarity. And one of the biggest mistakes organizations make during periods like this is operating purely defensively, trying to survive quarter to quarter. But the organizations that emerge stronger from disruption are the ones that use moments like this to reposition themselves, to modernize, to communicate differently, to become more intentional employers. I also think something else needs to be said. The continuing care sector has a branding problem, not because the work lacks meaning, quite the opposite. The work is profoundly meaningful, but younger workers today are evaluating employers differently. They're asking, will I be supported? Is leadership transparent? Is there flexibility? Is mental health taken seriously? Will I burn out here? Will anybody care for me as a person? And organizations that cannot answer these questions convincingly are going to struggle. Not because people don't want to care for seniors and others, but because people are no longer willing to destroy themselves doing it. That reality is not political, it's operational. And it's why the next generation of leadership is in continuing care must think differently. The old model was people just be grateful to have a job. That model is dead. Today's workforce wants meaning, support, transparency, flexibility, well-being, and leadership they can trust. Organizations that adapt to that reality will recruit better, they will retain better, they will perform better, and eventually they will financially outperform, because workforce instability is expensive. Turnover is expensive, absenteeism is expensive, distrust is expensive, poor communication is expensive, and burnout is expensive. The organizations that understand this earliest gain the biggest advantage. At Newground Financial, we're deeply optimistic about this sector, because despite everything happening right now, the people in continuing care still show up. That says something. It says there is still purpose, still commitment, still pride, still people willing to do extraordinarily difficult work for the right reasons. Our belief is simple. If organizations support these people properly, this sector can become stronger than it has ever been. But it will require leadership, not reactive leadership, not survival leadership, strategic leadership. The kind willing to rethink how organizations support people. As you walk through this conference over the next couple of days, I want you to think of one question. Not what are our benefits rates, but what kind of employer are we becoming? Because that question will determine who stays, who leaves, who applies, and who trusts you. And ultimately, the quality of care your organization can deliver over the next decade. And if that conversation matters to you, we genuinely love to speak with you. Not to give you a sales pitch, but to have a real conversation about what's actually happening inside of your organization. What your people are feeling, what your leaders are struggling with, and where the biggest opportunities may exist. Because we believe the future winners in continuing care will not simply be the organizations with the biggest budgets, they will be organizations that build the strongest trust. Thank you.